Hello. The issue I am presenting today is dementia, more specifically Alzheimer's disease. Why does this issue matter? There are a multitude of reasons, but I'm only going to tell you one. And the fact of the matter is that there is no cure for Alzheimer's and dementia. And to make things worse, it is a global worldwide issue. What people need to understand is that Alzheimer's and dementia have a crippling financial cost. The expenses of providing care, such as medical treatments, long-term care, and support services, they all keep rising in tandem with the number of patients. In many countries, families are frequently left to provide care, which strains caregivers emotionally, financially, and physically. Many of them are ill-equipped to handle the long-term responsibilities of caring for a person with dementia. In my family, we had someone who passed away almost 10 years ago who had dementia. Um, Personally, I learned from them that one of the greatest challenges that come with this disease is the loss of independence. They made poor judgments and forgot their friends, their families. They've repeated their words and their sentences on several occasions until they could no longer speak anymore. It was traumatizing when I was very young. I had to see how the life drained out of out of them over time when they lost their decision making ability. They also lost their communication, and then eventually they lost their memory. Um, at that point, life seemed bleak and no longer worth living. I wonder if it was terrible of me to think that they should be released from this miserable existence and finally, have the sweet embrace of eternal sleep. It was probably very horrible of me to think that way, but I would rather them be one step closer to God than for them to have to live another day wondering who they are and why they're surrounded by people they can't remember. So my call to action, the way we can help each other in regards to this issue and relieve the burden of dementia and Alzheimer's disease involves a combination of support, education, self-care, and medical advancements. We need to promote dementia-friendly initiatives, advocate for better healthcare access and government funding for dementia care, support nonprofits and research organizations working on treatment and caregiver support. By working together, caregivers, healthcare professionals, policy makers, and society, we can lighten the burden of dementia and improve the quality of life for both those affected and their loved ones. That is what we can do to help with this issue.